Welcome to the post-hype era of digital health. If 2021 was a champagne-fueled IPO party, 2025 was the cold shower. Today we're dissecting the great divergence between Ping An Health and Teladoc. One of them just cracked the profitability code, while the other is staring at a $16 billion crater. It's a tale of two ecosystems, one that built a fortress inside an insurance giant, and one that's still trying to figure out if it's a tech company or a clinic. Think of it as The Last of Us, but for health tech valuations. In the 2026 market, scale has become the most expensive lie in Silicon Valley. We used to think more users meant more power, but in virtual care, raw traffic without insurance integration is just a high-speed way to go broke. We're moving from teleconsulting to managed care 2.0. If your business model relies on individual clicks instead of institutional payers, you're not a healthcare provider, you're just a very expensive call center with a stethoscope. Look at the split screen of reality. Ping An Health, PAHC, just hit GAAP profitability by plugging directly into the mothership's 230 million user insurance engine. Meanwhile, Teladoc is grappling with a customer acquisition cost, CAC, that's effectively a financial parasite. PAHC treats its relationship with Ping An Group like a private high-speed rail. Teladoc is still stuck in traffic, paying retail for every single passenger. In this economy, efficiency isn't a goal, it's the only oxygen mask left. Let's talk about the $16.4 billion elephant in the room. To put that in perspective, that's enough money to buy every single person in New York a Tesla Model 3 and still have change for coffee. This isn't just an operational oopsie, it's the ghost of Livongo. Teladoc overpaid for growth during the stimulus check era and is now paying the premium M&A tax. Their balance sheet looks less like a tech giant and more like a cautionary tale about buying the peak of a bubble. Data doesn't lie, but it does get aggressive. PAHC's enterprise revenue surged 40.6%, while Teladoc's total revenue is actually shrinking by 2%. The B2C segment, specifically BetterHelp, is acting like a leaky bucket in a drought. Why? Because when the economy tightens, consumers cut their app subscriptions, but corporations don't cut their health mandates. PAHC is selling must-haves to CEOs. Teladoc is selling nice-to-haves to stressed-out individuals. If you want to know who survives 2027, look at the payer mix. PAHC is 60% anchored by commercial insurance. They've essentially automated the relationship between the doctor and the checkbook. Teladoc, however, is 82% dependent on access fees, a SaaS model that works great for Netflix but is terrifyingly fragile for healthcare. One is an integrated ecosystem. The other is a landlord charging rent for a digital waiting room. Witness the J-curve. PAHC's flip into the black wasn't a magic trick. It was a 4-year surgical strike on expenses. They trimmed management costs by nearly 4%, while their AI engine cut the cost of every single doctor visit by nearly half. It's the Amazonification of medicine. They've turned healthcare from a high-margin luxury into a low-cost, high-volume commodity. They're playing Tetris with their margins, and they're finally clearing the bottom row. AI is the most overused buzzword of the decade, but here, it's a literal life support system. PAHC's AI isn't just a chatbot. It's a 95% accurate triage engine that lets one human doctor do the work of 3. Teladoc is using it for risk stratification, which is fancy talk for finding the sickest people before they get expensive. In 2026, if your AI isn't actively lowering your per-visit cost, it's just a decorative paperweight on your server. Time for a forensic audit. PAHC has $1.3 billion in cash, but keep an eye on that $136 million in restricted assets. It's a litigation freeze that smells like a headache. Teladoc, on the other hand, is carrying $1.3 billion in intangible assets. In accounting terms, that's hope, written in ink. If those assets get impaired again, their equity will vanish faster than a patient in a crowded ER. One balance sheet is built on bricks. The other is built on goodwill and dreams. The silver tsunami is coming, a massive wave of aging humans who need constant monitoring. PAHC is building a home care 2.0 fortress in 100 cities, while Teladoc is doubling down on chronic diabetes management. This isn't just altruism, it's the ultimate lifetime value, LTV play. Once a senior is in your ecosystem, they don't churn. They aren't users, they're permanent residents of your digital ward. Let's be blunt, the Uber for Doctors model is dead. You can't fix healthcare with an app that just connects a random patient to a random doctor. You need a managed digital ecosystem, where the insurer, the technology, and the clinic share the same nervous system. In 2026, the winners are the ones who own the data loop, not just the interface. The next frontier isn't better video quality, it's actuarial data. The company that knows exactly when you're going to get sick is the company that insurance giants will pay billions for. PAHC is winning the data race because they see the insurance claims in real time. Teladoc needs to stop being a vendor and start being a risk partner. Otherwise, they're just a digital band-aid on a broken system. Here is your survival map for the next 24 months. 2026 is about AI clinical workflows. No more human transcriptions. 2027 is the transition to value-based care, where doctors get paid to keep you healthy, not just treat you when you're sick. By 2028, we're looking at hyper-personalized medicine driven by biodata. If you're not building this infrastructure now, you're already obsolete. The final verdict? Ping An Health has built a sustainable, profitable skyscraper on a foundation of insurance synergy. Teladoc is still a high-performance engine, but it's currently sitting in a car that's missing 2 wheels and a fuel tank. If you want the full-page forensic report with all the raw data, drop us an email. Let's talk about who really owns the future of health.